please. Thank you very much. We'll start in a few seconds. Good morning. We'll start the public consultation today with a prayer for the national anthem. Secretary, please.
Let us close our eyes, bow our heads, and feel the presence of the Lord. Heavenly Father, may the thankful voices of your children pass through your gates as we gather today, full of faith, joy, hope, love, and life. Despite the ambiguous situation of the world, we keep us safe and certain that we are cared for, sustained, and protected. Dear Lord, we implore you to help us cast our doubts so we may pour all our trust in you. Allow us to let go of our regrets and make amends for our faults and transgressions, and guide us toward the righteous path that you have always intended us to take. This day, we humbly invite your presence in this gathering of people and bless each one of us with focus, patience, and understanding. Let your thoughts and beautiful intentions flow upon us as we open our ears to receive them and keep them in our minds. Quench the thirst of our spirits as we open our hearts to welcome your overwhelming love. Oh Father, guide the lips of the speakers today, so we may hear the wisdom you intend us to receive. Steer the hands of the facilitators, so they may provide us the rightful aid we need. We pray for inspiration, so all of us may learn and work in unison in the honor of your name. We pray for serenity, courage, and light, so we may spread the learnings we receive in good faith through your grace. All this we pray in the glorious name of Jesus, our Lord. Amen.
Ako ay Pilipino, taas noo kahit kanino.
Mga kababayan, ang pambansang awit ng Pilipinas.
Bayang magiliw, talas sa silanganan, alak ng puso, sa dibdib mo'y buhay. Lupang hinirang, tuyan ka ng magiting, sa manlulupig, di ka pasisigin. Sa dagat at bundok, sa simoy at sa langit mong bakaw, may dilagang tula at awit sa paglayang minamahal. Ang isap ng matawat mo'y tagumpay na nagdilimig, ang bituin at araw na kailan pa may magdidilim. Lupa ng araw ng walhati pagsita, buhay lang isabihin mo. Ang hindi kaya na may mga api, ang mamatay ng dahil sa'yo.
Okay. Good morning, everyone. I hope everyone is in good condition right now. We are here to discuss to you and present to you the new schedule of fees and charges for the Food and Drug Administration. I'm your MC and moderator for today, Attorney Stella Maris from Antilia Banyares. So this is a virtual public consultation. No? In here, we will discuss a few of the of the stakeholders concerned regarding the draft administrative order for fees and charges. Maybe have a fruitful and productive public consultation. Just a few reminders po. We'll discuss first the house rules for this public consultation, virtual public consultation.
Ito pwede na
Okay. First, we have to be reminded of the few house rules that this virtual public consultation, so we can have a smooth flowing program of activities. Just slides for the house rules, please.
Ito po may house rules.
Ito na. Ito na lang i-share natin.
Hello, once again, good morning. These are just a few house rules, no reminders for this virtual public consultation. Can you hear me? Is it clear? The voice is clear?
Yes po. Yes po.
Okay, very much. Okay, just a few households again. Make sure that you have a very stable
Yes.
internet connection at home or wherever you are, no, while accessing this virtual public consultation. This webinar is recorded, so everything we have to say, everything, every little discussions that we have are all recorded. So please turn off all the microphones while someone is speaking, so we can clearly hear. So, okay. Again, no, adjust the volume of your speakers and for a better and clear quality of audio. This is very important so that we will be able to hear everything that the speaker is actually saying. So please adjust your microphones and
Sound lang, ma'am.
turn
May sound lang
on your
nakita.
microphone. So again, one of the most important in virtual public consultation.
Wala na.
Have mute your microphone. The only time you can mute your microphone is to be acknowledged to speak. No, unless and until such time, all your microphones and
Hindi tayo nakakontrol.
again, please be polite and courteous. Everyone here in this public consultation are all professionals, so let us treat each other with respect and let us be courteous to one another, both in the co-participants, the organizers, as well as the resource speakers. Let them finish their speech or their talk before one can actually say something. Next, please. Again, one of the most important virtual house rules that we have is we will only entertain one question and one follow-up question per institution or industry group. No, you can submit your questions in the chat box, and of course, please follow the format association or institution, and then your question followed by your questions or your comments. Again, we will be strict on this, so everyone will be given a chance to raise their concern with the Food and Drug Administration relating only to fees and charges alone. All other matters that are not related with the fees and charges shall be discussed in a different forum. Again, one question and one follow-up question per institution or association. Next, please. Open and regularly check the chat box for any announcements. No, FDA as well as any of you who are actually attending this virtual public consultation can use the chat box for any comments and or any concerns that you want to raise in this virtual public consultation. So please check the chat box regularly. Next, please. All of you are expected to have logged on to the attendance sheet. We will be giving you a link to be provided by our the organizers of this virtual public consultation. So please again check your chat boxes for the link that will be provided in order for you to log on your attendance. Thank you very much. We really hope that this virtual public consultation will be productive. We really hope that we'll be able to address all your concerns. Again, way to be acknowledged first before speaking. So we will have a smooth flowing of virtual public consultation. For now, may I introduce to you the FDA representative to be giving the welcoming remarks and opening remarks for this session. That's Attorney Nathaniel Liberato from the Legal Services Support Center of the Food and Drug Administration. Take it away, sir.
Thank you. Good morning, everyone. Thank you, Attorney Stella, for that House rules. Again, so I would like to officially welcome everyone to this public consultation on behalf of our Director General, Dr. Samuel Zacate, and the entire FDA Fees and Charges team. I would like to welcome all of you to today's virtual public consultation for our proposed revision of fees and charges. So to officially open this public consultation, I would like first to give a brief background on this issuance. Okay, so this initiative of the FDA was brought about by the federal government's thrust to improve the delivery of basic public services to the people And with this, the FDA initiated this
Alarm at 10:20 a.m.
to cope up with the previous effects of the pandemic and of course to balance our basic services to our stakeholders. In average, after our data and research, it come to our attention that there's this proportion as to the average income of the FDA as opposed to its expenses. And with this, we hope that we can sustain our services and of course improve our delivery to the stakeholders. Thus, we plan to update and rationalize our existing fees and charges. In closing, again, I would like to thank all of you for taking this time to actively attend and register with this public consultation. So without further ado, I would like to pass on to our next speakers, who will exhaustively present and discuss the proposed fees and charges. Thank you.
An, Annabel, ito, pwede daw.
Okay. Good morning, everyone.
Laptop.
For a while, we'll be checking our. Okay. Good morning again. Good morning to our participants, our fellow civil servants in the government, officials, and employees of the Food and Drugs Administration, of course, our stakeholders, the FDA stakeholders and clients. So my name is Attorney Jason Raposas, the Division Chief of the Special Research and Technical Services Branch of the National Tax Research Center, an attached agency of the Department of Finance. With me is my senior staff, Mr. Whitman Ramos. Okay, so our role in this public hearing is to give technical support, and we will also be giving the legal basis in the background to this public hearing, to this endeavor of the FDA. So, next slide. First, we will be providing the role of the NTRC as the secretariat to the task force on fees and charges in rationalizing the fees and charges of the FDA. So we'll give you an overview of what I will be talking about. So I will be talking about the task force on fees and charges, as I said, and the composition and functions of the task force. And then I will give you a brief overview of what are fees, the concept of the fees, the rationale of the imposition and the revision of fees, and the procedure and the imposition of the new or revised fees, or the revision of the fees. So first, the task force on fees and charges. To give a little background on why the task force on fees and charges was created. Before Batas Pambansa Bilang 325 series of 1982, the imposition of fees are through legislative acts. So if you can just imagine the number of agencies, GOCCs imposing fees and charges, and if these are imposed through legislative acts, you can just imagine the slow pace on how these fees are updated. Okay, so in 1982, Pambansa Bilang 325 was enacted to delegate to the head of agencies and department heads the power to regulate and administer the imposition, collection, and the revision of fees and charges. So this became the basis for the succeeding presidential directives and issuances for the national government agencies, then later on for the GOCCs to upgrade and
Attorney, nakamute po kayo. And yung slides po, hindi po nagmo-move. Thank you po.
Okay. I think mayroong technical kasi nasa isang bang slide na kami. So sorry for that. So I'll just repeat what I was just talking about. Naglalag yata kasi nasa mga sa first slide. Yan. Hindi pa rin change dito sa aking monitor.
Naka full screen sa share sa amin.
Yan, overview. Can you see the slide?
Yes.
Yes, attorney, okay na po.
Okay na. Okay, sige. Kaya, kala ko na no? So I'll just repeat and I'll just introduce ourselves. So good morning again to everyone. So my name is Attorney Jason Raposas, the Division Chief of the Special Research and Technical Services Branch of the National Tax Research Center, the NTRC, an attached agency of the Department of Finance. With me is my senior staff, Mr. Wilman Ramo. So today in this public hearing, we'll be providing some technical support and some legal basis or background to this endeavor of the FDA. So we will be providing the role of the NTRC as the Secretary to the Task Force on Fees and Charges, rationalizing the fees, and the overview of how we arrive at these fees. So I will be talking about the task force, the composition of the functions of the task force, the definitions and the types of fees, the concept of fees, the rationale on the imposition and revision of fees. Lastly, the procedure on how to impose or revise fees. So the task force on fees, before the creation of the task force on fees and charges, and also before the enactment of Batas Pambansa Bilang 325 of series of 1982, the imposition of fees, the updating of fees are all through legislative acts. So you can just imagine the slow-paced updating of these fees, because they could also can only be updated through a law or through the revision of laws. And also it goes through Congress. So to remedy that, the Batas Pambansa Bilang 325 series of 1982 was enacted. The law delegates the head of agencies, department heads, the power to regulate and administer the imposition, collection, and the revision of fees. This also became the basis for the succeeding presidential directives for the national government agencies and later on to government-owned and controlled corporations to upgrade their fees. So in 1987, the Administrative Code of 1987 was issued that institutionalized the delegation of revising of the fees and charges. So particularly on Section 54, Title 4, if I'm not mistaken, stated there that the head of bureau, office, or agency may charge and collect the cost of service, supplies, articles, or other rates in excess of cost prescribed by law or approved by the same authority. So the continuing authority, this administrative code gave a continuing authority to the heads of agencies, departments, to impose and collect and revise fees and charges. So in 1996, to further support the revision of fees and charges, the updating of the fees and charges, Administrative Order number 255 of 1996 was issued. This administrative order created the task force on the revision of fees and charges to synchronize the accounting, reporting, collection of fees, and ensure the monitoring and the revision of fees and charges of agencies concerned. And Executive Order number 2180 of 2000 reactivated the task force. It also,
Sorry
yes.
po, Attorney Raj. Sorry po. Hindi po nag-move yung ating slide. The participants are requesting that it be presented on a slideshow mode, please. Thank you. You can share it with us. So we will be the one to present it na lang po. So we can assist you. Would that be okay? Sir, nakamute din po kayo. We can't hear you. Thank you po. Attorney Jason, sorry.
May nag-wait yata sa akin. Okay. I-send na lang yung slides. Kasi parang kanina kahit yung first presenter, naglalag din yung kanyang slides. So, I think that's a recurring problem.
Yes, I think, attorney, may glitch po sa ating connection. But right now po, the connection here at Kingston Excel building is one naman po. Sir, so maybe we can help you or assist you with the presentation of your PowerPoint. Maybe you can send it to us, attorney. Thank you. Sir Attorney, but we will put in the chat box po the email address where you can send the presentation.
Okay.
Thank you.
Good morning po. I already sent po the PDF po ng PowerPoint sa email po ng Policy Planning Service. I-check na lang po. Thank you.
Hello, good morning. Let's have a few minutes break, probably a 2 to 3 minutes break. We'll just get the PowerPoint presentation ready. Thank you. Okay, good morning. Let us resume po, attorney, at your signal, attorney. If you're ready, please let us know. Can you now see the presentation clearly on your screen?
Yes po.
Very much.
Okay.
May echo po sa audio nyo, attorney.
Okay, how about now? Okay na ba?
Yeah, better po. Thank you very much.
Okay.
Thank you very much.
Andun na tayo sa slide, ano slide na ba yun? Slide 7 yata. Okay na mo, slide 7. Yeah.
Wala na sila.
Okay, sa slide 6. Slide 6. Yeah, hindi, yung inano ko kanina, yung reactivation of the task force on fees and charges. That was done in 2000 that was the issuance, Executive Order number 197, where the national government agencies were required to increase their fees by a minimum of 20%. And so also through that issuance, another function was added to the Secretariat, which is to render technical assistance to national government agencies upon request. Okay. Next. The most current issuance is Administrative Order number 31 series of 2012, where all government agencies and GOCCs should rationalize the rates of their existing fees and charges, or increase if they find that there's a need to increase the rates of and impose new fees if necessary. So one of the point of administrative order is to rationalize the fees. So meaning if there are particular services that requires removal of fees, or there are particular services that requires to be added and impose fees, then they may do so. So as administrative order number 31, next slide. Yes, next slide. Gave the task force on fees and charges new mandate, and the composition of the task force on fees and charges is the chairman and the co-chairman. The chairman is the Department of Finance, and the co-chairman is the secretary of the Department of Budget and Management. Next, and the members are the Bureau of the Treasury, which prepares the quarterly reports, collections, etc. And the other member is the Commission on Audit, which of course examines and audits the collections. And lastly, the National Tax Research Center.
Recording in progress.
Also the Secretariat to the Task Force on Fees and Charges. So among the functions of the task force, which is mainly exercised by this NTRC, is to monitor compliance of the NGAs and GOCCs to AO31 of series of 2012 and other pertinent issuances, and provide technical assistance, as I've said, in the rationalization of the rates of fees upon request of the NGAs and GOCCs, and to ensure uniformity of the new and revised fees with other NGAs or private sectors offering similar or comparable services. So the task force, so you could actually glean from these issuances the importance of the fees, such that they created a specific task force to monitor compliance of these NGAs. So why do we need to have this compliance and monitoring in the imposition of fees? So next slide. We have the definitions, the concept of fees. Next slide. So what are fees? So fees are levies imposed on direct recipients of public goods and services, the NGAs and GOCCs, and the exercise of their mandated regulatory and service delivery functions. So there are different types of fees. So fees can be generally categorized into two: the service fees or the user fees, user charges. So service fees are imposed to the direct recipient of goods and services, and are commonly known as user fees. And the regulatory fees, which are imposed to encourage efficiency and equity, and may also serve as sumptuary devices to discourage or regulate certain services or activities. So aside from, so the imposition of fees is actually not for revenue, not for revenue purposes, but actually to only to recover the cost of the service. And also fees are used to as a what we call this as an exercise of the police power of the state by through regulations, done by regulatory agencies. So what are the rationale for the imposition and the revision of fees? So why the fees are imposed and why fees are revised? First, the efficient resource management. What does it mean? It means the government would like to use its resources to its optimal use, meaning taxes collected, priority spending for taxes ideally should be with the priority government projects, such that for government services involving the delivery of services, we impose fees so that we don't subsidize these government agencies through their tax collections, and that they could use the fee collection as a support to continue the delivery of these services. So that is why one of the main rationale of the imposition of fees and the updating of fees is through the efficient management of scarce government resources, especially tax collections. The second one is the uniformity for comparable services. And then for AO 31, it added another rationale, which is the balance, to maintain the balance between cost recovery and socioeconomic impact of these fees that are imposed to stakeholders. So there are some consideration for some social services. And the last one for the revision of fees is the length of time that the fee or charges have been revised. So we could connect actually the last rationale to the efficient resource management, because if the fees are not updated, the tendency is these delivery of services are often subsidized by the government. Okay, so next. So we come now with the procedures in the imposition and the revision of fees. So the procedure is contained in the IRR of AO 31, which is the DOF DBM NEDA Joint Circular Number 1-2013. So the procedures are as follows. First one is the creation of the revision of fees committee. So for the FDA, they have their own committee in the revision of fees in the study of to whether or not impose fees on which services the needs updating or needs position of new fees. The second one is after that determination, then there is the computation for the rates of fees. So they have to come up with the rate of fees that is commensurate to the cost of the service. So that's also where we come into picture, as the Secretariat of the Task Force of Fees, providing technical services to the agencies. The third one is the publication and posting on the website, on our conspicuous places in the office. And the fourth one right now is the conduct of public hearing. That's why we are here right now, public hearing, to give due notice to our stakeholders of the impending increase in the fees. Next is the after the public hearing, these are revised again to reflect whatever is the sentiments or feedbacks from the public or from the stakeholders. And then after that, they submit the final proposed fees to the head of the agency, or for the OCCs, that's the board, the governing board, for their approval. After the approval, needs another publication, posting on the website, conspicuous place in the office. And lastly, the reportorial requirements to the task force and fees and charges that is with us, with the National Tax Research Center. So, having said that, in the computed, the second step, which is the determination of the rates of fees, as the Secretary to the Task Force on Fees and Charges, we have formulated a template on how to compute with the rate of fees. So we'll just give you an overview. We will not be discussing in detail on how we computed for this cost. So first, we determine what are the cost variables in the delivery of the service. So we have two main cost variable, which is the direct costs, or those which are mainly attributable to the delivery of the service, and the indirect cost or the imputed cost. Under the direct cost, we have the personnel salary, the supplies and materials, the semi-expendable items, and the capital outlay, which composed of the facilities and the tools and equipment used in the delivery of service. And lastly, the utilities that are used in the delivery of service, like electricity, water, etc. So the total cost of all these cost variables per capita is your rate of fee. Okay, and just to give you an overview again of how do we compute this and how we determine these cost variables, we require national government agencies and UCCs to provide us with a workflow process that is the main basis through which we determine what are the cost variables involved in this delivery of service. So that at each level of the workflow, we identify the personnel involved, the time spent, the supplies, materials, semi-expendable items, capital outlay, among others that may be required. Each step of the workflow. And then lastly, we impute the salaries, wages involved with the rendering the service, including all this I have mentioned above. And through that, we arrive at the rate of fees. I think that's all. Thank you.
Thank you very much po, Attorney Raposas, no? And to all our stakeholders po, no, we presented to you the basis or the rationale behind the increase, no, of the fees and charges that are being done by the government agencies. One of which is the Food and Drug Administration. And for so long po, no, we haven't increased our fees and charges. I think more than 20 years. That the Food and Drug Administration remain their fees and charges. So this is the only time that we have decided to increase our fees and charges. So definitely we'll see significant changes from the fees and charges from our old fees and charges. And the reason why we ask the assistance of the National Tax Research Center through Attorney Raposas to help the Food and Drug Administration to actually come up with a computation that is based on actual costing, no, and breakdown of all the all the necessary factors and variables that we need, no, to come up with the fees and charges that we have right now. And let me emphasize further, no, the direct that Attorney Raposas is actually mentioning a while ago, that these fees and charges are based on those direct and indirect costs. And for so long, no, as I've mentioned a while ago, it's been more than 20 years, no, that the Food and Drug Administration have not increased their fees. We have been subsidizing, no, all our fees and charges, especially the inspection and EMS activities of the Food and Drug Administration, because those are not part of the fees and charges or the existing fees and charges right now. So very much for letting us know, and as well as stakeholders know about how the mythic industry, we, under the national government agencies, come up with this computations on the revisions of fees and charges. Definitely po, no, this has undergone a lot of revisions, a lot of meticulously review of all the provisions of the administrative order, as well as the computation that you will be seeing in the next few slides that we'll be presenting to you. Our next presenter would be the OIC of the Litigation Enforcement Division of the Food and Drug Administration. She is currently actively participated in the revisions as well as the computations of the fees and charges of the Food and Drug Administration. Again, may we call on Attorney Vanessa Legasto to discuss to you the presentation of administrative order on fees and charges.
So good morning. Thank you so much, Attorney. Thank you so much, Attorney Snell, for the introduction. So as part of the program now, we're heading towards the presentation of the draft administrative order. I'll be doing a rundown of the contents, starting off with the subject, which states implementing guidelines on the schedule of fees and charges of the Food and Drug Administration for licensing, registration, and other authorizations and regulatory services, repealing Administrative Order Number 15, Series of 2001, entitled Revised 2001 Schedule of Fees and Charges for the corresponding services rendered by the Bureau of Food and Drugs and its amendments. So that basically sets the tone of the contents of the administrative order that is being proposed now. So going further, I shall be reading the first item of the draft, which is the rationale. So the Food and Drug Administration is mandated by the Public Act Number 9711, also known as the Food and Drug Administration Act of 2009, to license all the establishments or facilities and issue product market authorization on all health products prior to manufacture, importation, exportation, sale, opening for sale, distribution, transfer, non-consumer use, promotion, advertising, or sponsorship. Accordingly, to protect public health and uphold consumer safety, the FDA conducts post-market surveillance of health products and establishments or facilities to ensure that adulterated, unregistered, or misbranded health products are not offered for sale or use. Pursuant to Article 2A, Section 2S of the Implementing Rules and Regulations of the Republic Act 9711, the FDA is authorized to review its fees periodically and propose any increase and promulgate rules and regulations governing the collection of other related regulatory fees. Accordingly, under Article 2B, Section 3 of the said Act, the FDA is authorized to collect, retain, and utilize or apply all fees, fines, royalties, and other charges collected by it under Section 31 of the Republic Act Number 9502, also known as the Universally Accessible, Cheaper, and Quality Medicines Act of 2008, which includes upgrading of its facilities, equipment, outlay, human resource development and expansion, acquisition of the appropriate office space, as well as purchases of laboratory equipment and motor vehicles, upgrading of its current facilities and equipment and maintenance, funding for operating expenses of the central office laboratory divisions and satellite laboratories, and other activities or services of the FDA in the performance of its mandate. With the current innovations in technology and the improvement of the country's economy, evidenced by the flourishing volume of industries and health products, a commensurate increase in the fees and charges is considerably needed to be able to meet and sustain the increasing demands of providing FDA's stakeholders quality and efficient services. For more than 20 years, the rate of fees and charges of the FDA has been referred to the Administrative Order Number 50, Series of 2001, or the revised 2001 Schedule of Fees and Charges for the corresponding services rendered by the Bureau of Food and Drugs. Thus, in view of the foregoing, a revisit and consequent repeal of Administrative Order Number 50 of Series of 2001 is deemed in order. So basically, the rationale to the DPN number of Administrative Order Number 31, Series of 2012, on the rationalization of rates of fees and charges, increasing existing rates and imposition of new fees and charges. The FDA is restructuring its fees and charges at a level commensurate with the cost of regulating health products, establishments, and facilities to protect consumer safety and public health. Thus, the following guidelines are hereby adopted. So, going to the next item, which is the objective or the purpose of this administrative order. Let me read. This administrative order is issued to prescribe the schedule of fees and charges for the services rendered by FDA and provide the guidelines for its implementation. Clear naman po, I just want to verify kung okay po yung ano natin, yung sa audio. Okay. Third item, which is the scope. It says the new schedule of fees and charges shall apply to all persons, establishments, or facilities and health products under FDA's jurisdiction, whether public or private, including but not limited to national and local government agencies, state colleges and universities, and schools availing of FDA services. Before I proceed to the next one, I shall ask lang po for assistance on possibly enlarging the slide presentation. So let me continue. The fourth item is the definition of terms. Here we provide for the following terms that will be used or it's actually used across the entire draft, the contents for easy reference and understanding of course, the stakeholders for your consumption. So for the purpose of implementing this order, all terms used in this order that are already defined in RA 3720 as amended by EO number 175 and RA number 9711 shall have the same meaning as defined therein. For emphasis, the following terms shall be defined as follows. First, accreditation. It refers to the attestation conveying a formal demonstration of a laboratory's competence and capability to carry out specific scientific and technical tests or analytical services with respect to health products. Authorization shall refer to the permission embodied in a document granted by the FDA to a natural or juridical person who has submitted an application to implement the manufacture, importation, exportation, sale, offer for sale, distribution, transfer, and or where appropriate, the use, testing, promotion, advertising, or sponsorship of health products. The authorization can take the form of a permit, a license, a certificate of registration, of accreditation, of compliance, or of exemption, or any similar document. Item 4. Center, we define center as any of the following. Of course, ito po yung bumubuo ng FDA. We have Center for Cosmetics and Household Urban Hazardous Substances, Regulation Research or the CHUSER, Center for Food Regulation and Research or the CFRR, Center for Drug Regulation Research, the CDRR, and of course the Center for Device Regulation, Radiation Health and Research or the CDRHR of the FDA. Establishment shall refer to the sole proprietorship, a partnership, a corporation, an institution, an association, or an organization engaged in the manufacture, importation, exportation, sale, offer for sale, distribution, donation, transfer, use, testing, promotion. Up na po yung slides. advertising or sponsorship, of health products, including the facilities and installation needed for its activities. So for item E, evaluation, it refers to the process of reviewing submitted regulatory documents by applicants based on existing standards, rules, and regulations of the FDA. Health products, on the other hand, shall refer to food, drugs, cosmetics, devices, biologicals, vaccines, in vitro diagnostic reagents, and household urban hazardous substances, and or a combination of and or a derivative thereof. It shall also refer to products that may have an effect on health, which require regulations as determined by FDA. Health product vigilance refers to the science and activities relating to the detection, assessment, understanding, and prevention of adverse effects or any other possible problems from health products. Initial application shall refer to the term used for a first-time origin application for any authorization as defined by Republic Act Number 9711. Item G, please, yung slides ko. Item I, okay. Micro, small, medium enterprises or the MSMEs. It refers to the definition according to Republic Act 9501 as any business activity or enterprise engaged in industry, agribusiness, and or services, whether single proprietorship, cooperative, partnership, or corporation, whose total assets, inclusive of those arising from loans, but exclusive of the land on which the particular business entity's office, plant, and equipment are situated, must have value falling under the following categories. A, micro, which is not more than 3 million, small, which is has an equivalent of 3,000,001 pesos, but not more than 15 million, and medium 15,000,001, but not more than 100 million. More than 100 million is considered a large enterprise. Next po, item J. The issuance. It refers to the process of granting a duplicate copy of a valid authorization due to loss or damage of the original authorization. This is only applicable when the document issued by the FDA is a hard copy and not an electronic copy. So, may limitations on how we define the issuance. No? So, renewal, on the other hand, shall refer to the process of filing an application for the extension of the validity of an authorization. Under item L, risk-based regulation, it refers to the approach on regulating health products, establishments, and facilities by targeting activities that pose the highest risk to the public well-being, and in turn lowers the burden for a variety of lower-risk sectors and firms. Lowering burdens improves compliance and allows firms to benefit from a more level playing field by directing the government resources towards the highest risk areas. Risk-based approaches also make the most of limited public resources and further improve accountability by enhancing transparency and predictability of requirements in given sectors and is applied to different establishments. Variation and or amendment, on the other hand, refers to post-license changes in the status, circumstances, conditions, claims, or activities of other in accordance with yes. Adjust lang po natin yung sa slides. Okay, so the next section of the AODAS, which is guidelines, provides for subsection A, stating the new schedule of fees and charges as attached under annexes A to F as follows. Annex A for fees and general certification that will be common to all centers. So medyo general po yung application yan. While the specifics are provided from Annex B to Annex F. Annex B for center per chooser, Annex C for the CDRR, Annex D for the CDRR-HR, and Annex E for CFRR. Annex F, on the other hand, would basically map out those corresponding to Common Services Laboratory. Item 5 guidelines, subsection B, provides for the application fees for granting an authorization, accreditation, prescribed in this issuance shall cover, but is not limited to the following activities: receiving of application documents, pre- and post-licensing inspection of facilities for medical device, pre-marketing activities including but not limited to assessment, technical evaluation, and pre-licensing inspection of establishment. Post-marketing surveillance of products and establishments but not limited to the following: collection of samples, laboratory testing, complaints and reports processing, safety monitoring, post-licensing inspection, routine or special inspection, health product vigilance. Next po. Post-evaluation, product verification, advertisement monitoring, printing, records management, archiving, and administrative support, government career services to deliver the authorization, if applicable, IT systems, and maintenance and development, security seal, and all other related activities. Next item po. Under item C, the application fees shall not cover the following expenses. UP Law Center's legal search fee, which is equivalent to 10 pesos or percent of the application fee, whichever is higher, as imposed by, of course, Republic of Number 3870 or as amended by PD 200 and further amended by PD 1856, of which FDA is only the collecting agent as per letter of instruction number 1182 dated December 16 of 1981. Other fees incurred from the use of payment collection facilities, such as service fees charged by banks authorized by the FDA to collect these fees, private or special courier used for the conveyance of the certifications. So basically, ano po ito nga, exclusions po ito dun sa application of fees that we will be presenting. Subsection D, on the other hand, states the FDA shall issue updated guidelines regarding new payment modes and methods as necessary.
Yes,
One, over-the-counter online LBP portal or through online bills payment, banknet, other payment channels as may be determined with FDA. Somehow this is an obligation. However, there will be other payment channels issuing corresponding guidelines that the stakeholders can refer to as a payment mode. So subsection E of item 5 states all payments shall be made not later than the date reflected in the order of payment. Payments beyond the validity of the OP shall be automatically forfeited. Application payments made including but not limited to the following shall not be accepted and posted in the system. First, application payment with incomplete or insufficient amount paid. Application payment with an incorrect reference number provided. Application payment made through an unauthorized payment channel. Application payment made beyond the validity of the issued FDA order of payment or the OP, and such other cases as may be determined by the FDA. Applications with deficiency payment shall be posted after the proof of the full payment is made. So changes and or additions to the existing FDA payment channel shall be announced to a separate issuance, which is yung mentioned earlier. The size of business operation used by chooser and CFRR for licensing purposes by asset shall be in accordance with RA 9501 and its amendments. Provision of support and assistance to MSMEs may be provided under the coordination of government efforts as stipulated in RA 9501 Section 5C and its future amendments. Future related provisions will be carried out. Flexibility in payment of fees and charges may be applied by the FDA in lieu of public emergency or state of calamity declaration and other directives from the Office of the President. Of course, there will be corresponding issuance and regulations in on this matter for proper guidance. So under item 6 or the validity period for authorizations, it says the validity period for authorizations, permits, and certificates shall follow existing FDA issuances. Item 7, the surcharge or penalty imposable, consistent with Republic Act number 9711 and the corresponding implementing rules and regulations and other relevant FDA regulations. The conditions for the imposition of surcharge or penalty are provided below as follows.
Yes.
Pursuant to Section 3, Paragraph A2 and B2 of Article 1, Book 2 on licensing of establishments and registration of health products of the IRR of Republic Act 9711, applicable surcharge or penalty shall be imposed for applications for renewal of LTO or CPR received after the date of their expiration. This rule shall apply even in succeeding renewal applications. An application for renewal of an LTO or CPR received after its date of expiration shall be subject to a surcharge or penalty equivalent to twice the renewal licensing fee, an additional 10% per month or a fraction thereof of continuing non-submission of such application within the maximum of 420 days from the original shall be considered valid and existing until a decision or resolution by the FDA is rendered on the application for renewal. LTO or CPR applications filed beyond the 120 days application shall subject to a fee equivalent to the total surcharge or penalty plus the initial filing fee, and the application shall undergo the corresponding filing and evaluation procedure. Kasi po, naging initial na po siya whenever we have filed beyond the stipulated period under the law. Item 8 says mandatory review. The fees and charges shall be subject to mandatory review every 3 years. The PPS or Policy and Planning Service shall undertake periodic review, conduct consultations with stakeholders, and recommend amendments to this administrative.
Ha? Naka-mute ka, Attorney Van?
If I may ask po, sa pong section nawala yung audio natin? Ma'am Nanette, if ma-recall, para so I can repeat. Kasi po, we're now discussing the repealing clause. So, shall I proceed or meron kung hindi ako na-touch na na-loss natin yung audio?
Yung last paragraph lang po, attorney.
Sa 8, Attorney Van?
Yes po.
Section 8.
Okay, sige po. Because this is also part important, mandatory review. It says the fees and charges po shall be subject to mandatory review every 3 years. The PPS, Policy and Planning Service, shall undertake periodic review, conduct consultations with stakeholders, recommend amendments to this AO to the Office of the Director General for approval of the Secretary of Health as may be deemed necessary. So now, we shall proceed with item 9, which is the repealing clause. So ano po yung mga issuances na sought to be supplemented by this AO na i-repeal po niya. So item 8 provides for Administrative Order number 50, series of 2001, as a stated post title, subject natin kanina, entitled Revised 2001 Schedule of Fees and Charges for the corresponding services rendered by the Bureau of Food and Drugs. Item before. I-up lang po yung ano. Ayan. Okay, so item B, AO number 18A series of 1993, entitled Standards of Quality and Requirements for the Processing, Packaging, and Labeling of Bottled Drinking Water. AO number 15A series of 1995, entitled Guidelines Governing the Implementation of the Sangkap Pinoy Seal, or the SPS program, and the collection and disbursement of fees generated from the program. AO number 29 series of 2000, entitled Amendment to AO number 23 series of 1999, and AO number 50 series of 1999, fees and charges to be collected by the Radiation Health Service. Next po. Paki-up lang po, Secretariat.
Hindi siya nagkaan. Dili lang.
Okay, so Article 3, Section 2 of the DTI-DOH Joint Administrative Order number 1, series of 2000, entitled Prescribing a Schedule of Fees and Charges for Sales Promotion Activities. DOH AO number 47A, series of 2001, entitled Rules and Regulations on the Registration, including approval and conduct of clinical trials, and lab or batch release certification of vaccines and biological products. AO number 82, series of 2003, entitled Guidelines on the Granting of Diamond Sangkap Pinoy Seal to Manufacturers of Fortified Products. So under item H, it also seeks to repeal AO number 2008-0033, entitled Rules and Conditions in Exempting Antibiotic Drug Products from Batch Certification Requirement, amending for this purpose item 3, C, and D of AO number 103 series of 2002, or the batch certification of antibiotics, and for other purposes. Ako, Secretariat. Under item I, AO number 2012-0024, otherwise known as the amendment to AO number 50 series of 2001, covering fees and charges for accreditation of bioequivalence testing centers and private testing laboratories, as well as audits and inspection. FDA Circular Number 2011-004, entitled Computation of Surcharge or Penalty, imposable in case of submission of renewal applications, covering license of establishments and registration of health products after their date of expiration, pursuant to Section 3, paragraphs A2 and B2 of Article 1 of Book 2 of the IRR of Republic Act 1911, and other purposes. Item K provides for DOH Administrative Order Number 2019-0010, entitled Guidance on the Regulation of Operators of Pest Control, Certification of Pesticide Handlers, and accreditation of their training providers. Annex E, specifically the schedule of fees for the license to operate for pest control operators. And item L, it says this is also included as amongst those that will be repealed. FDA Circular Number 2013-001A, entitled Amendment of FDA Circular Number 2013-001. Item M provides for FDA Circular Number 2023-003, entitled Guidance on the Filing and Submission of Acceptable Variations and Protocols and Non-Standard Protocols for the review and pre-approval by the Food and Drug Administration prior to the conduct of bioefficacy test studies of household pesticides for the purposes of securing a certificate of product registration. FDA Circular Number 2015-001, entitled Clarifications on the Regulations Governing Principal Identical Drug Products, as defined under AO Number 2005-0031. Okay, that's the last item for the repealing clause. Now, under Section 10, Superability Clause, it is provided that if any provision is declared unauthorized or rendered invalid by any court of law or competent authority, those provisions not affected thereby shall remain valid and effective. Item 11 naman, on the other hand, provides for the implementation ng ating draft paper. So order shall take effect 15 days after the required publication, which is publication in the official gazette, or in any newspaper of general circulation, and upon filing with the University of the Philippines Law Center Office of the National Administrative Register, or the ONMAR. So we have here, of course, the Secretary of Health as the signatory, and Annex A po siguro. I should be touching also on Annex A, which basically provides for the fees na general to all centers. So, ano po to, kumbaga, standard yung fees, hindi nagba-vary from one center to another. So, just wait lang po, no? The Secretary is trying to fix the presentation. Thank you.
Kasya ba? Hindi na. Kasya ba? Yeah. Hindi ka na. Pilitan ka. Konti. Konti. Palitan mo.
So now we have here sa screen po natin, no? As we can see, Annex A, fees on general certification, which is like I said, common to all centers po ito, no? So from the left na tab, excuse me, leftmost na column natin, there's the certification type, and on the other side naman po, the fees imposable. So first item ng certification, the issuance of an authorization or license for lost or damaged original. So we would be imposing 500 pesos for that. And then item 2, sales promo permit. These are the categories po below. Discounts in type of promotion. So NCR only or in several regions, including NCR or nationwide, 500 pesos. More than one region but excluding NCR, 500 pesos. Several provinces, cities, municipalities within a single region, 200 pesos. Single province or city municipality, 100 pesos. Item 2.2, up lang po, Secretariat. Sige po. Item 2.2, non-discount scheme type of promotion. So, amount of prices based po siya no, up to 50,000 pesos. Sorry, we lost the presentation. For a minute lang po. Okay. So, amount of prices based po siya no, up to 50,000 pesos. It should be 250 pesos, 50,000 1 peso to 150,000 pesos, 500 pesos, 150,001 pesos to 300,000 pesos, 1,000, 300,001 to 500,000 will entail a 2,000 peso imposable fee. 500,001 to 1 million, 3,000 pesos. Above 1 million, it's 5,000 pesos po. And then pre-assessment fee naman po as another item po no, of certifications natin. 200 pesos. Permit to carry or mail, personal use, 160 pesos. Permit to carry mail R&D use, 160 pesos. Authentication or CDC, 100 pesos per page. And then, of course, other certification fee, that's verification permit. Na under the ledger, except here it says specifically mentioned in other annexes. So all fees po are subject to an additional 1% for the correspond po sa legal research fee na dinefine ko natin earlier sa draft AO po. So basically that is the draft AO po. For the succeeding po na mga annexes, it would be touched during the breakout sessions. So I shall pass on the line to our host po. Thank you very much.
Attorney Van, so answer full, no, very ang ating discussion talaga is masyadong, or yung discussion or presentation on the AO is really very technical, no? Even the terms that are being used in the draft A are also technical, but again, dito na tayo sa exciting part po ng ating virtual public consultation. We are now at the question and answer portion. Again, may I remind everyone po that these virtual public consultations shall only tackle or discuss provisions or the revisions of the fees and charges that was presented by our presenter, Attorney Vanessa Legasco. The administrative order proper as well. And also be discussed during the breakout session. For now, we will be entertaining questions po, no, from the audience relating to administrative order. So that our lines are all open. The chat box are all open. So you can all type in all your questions or concerns